So she had her first two bottom teeth come in first, and so she was just kind of like a little.
Welcome to Tired Parents Club. I'm your host, Kevin Pinto. I'm with Sierra Langford, also
Hello.
our host. And we are here to talk about our kids and teething. Welcome to the show again. We talk about our kids. This is a safe place to talk about our kids. We can talk about whatever we want. Poop, teething, first day of school, just everything about raising the littlest versions of ourselves. Sierra, who are we talking to today?
Yes, hello. Today we have with us Annie, Queen City News Now anchor. Thank you so much for joining us.
Thanks for having me.
And yeah, today we're talking about teething.
Fun.
Yes. So can you go into a little bit about how has it been with your daughter and teething so far?
So I have a 1-year-old. She just turned 1 at the beginning of September, which is crazy.
September babies.
It's September
flies.
babies. I know it
Yeah.
flies. The old saying is true. The days are long and the years are short. I feel like I blinked and here we are. It's fun, as I'm sure you guys know. Kevin, Lila is 5 months old?
Yeah,
now?
well, 5
Yeah,
months.
and Liam is 2, 3.
2.5. He'll be
2.5,
3 in
3.
December.
Yeah, that's right. He's a little Christmas baby.
Mm-hmm.
But it's so fun watching them hit all these milestones. But at the same time, you're wondering, like, things are coming. Like, all humans have teeth, or most of them. I think there's some. I'm going off on a tangent. There's got to be some like disease or like thing where you don't have teeth.
I think
I
that
know
happens
there-
to us eventually.
That is they fall out eventually. But we all know that the teeth are coming. But if you look, as we all know, Google's our best and worst friend. We Google when that's supposed to happen, and it gives you such a wide range. So you're just like, I don't know. I think they're coming at some point. So Kevin brought this to me and is like, oh, does Maddie have? Is she teething? Does she have teeth? Well, she's a year now, so she has 7 teeth.
Ooh.
Well, she has 6 that are like fully up out there, and then 1 that's like really poking through. So, when we were having a lot of sleep issues, which if you have another podcast topic about sleep issues, like
We are tired parents, so yeah, probably.
I will come and talk about that because it was
Sleep definitely needs to be its own episode.
Yes, we're doing, and I'll join in on that. Like, I have a lot to say, but when all that was happening, and she was just so irritable, and she was drooling so much, and I had one of my best friends visiting who has 2 kids, and she was like, "Oh, she might be teething," and I was like nervous to like put my hand in her mouth and like check for it. And so I had my friend Allie do it. I was like, Allie, can you do it? Like, can you do this for me? And so she did, and like obviously washed her hands like really good. And she's like, no, I don't feel anything. Like to talk about teething, I feel like she drooled for like months on end until they finally popped out.
What month was that? What was the first sighting of a tooth?
I want to say maybe, oh my gosh, I'm gonna have to look back in my camera roll. Was it like maybe about 5 months?
Okay. Yep, that was Liam.
Maybe
It's the
about
same.
5 months or 6 months, 7 months.
It was just a lot of drool, I'm sure.
It was a
It's
lot
kind
of
what-
drool.
and you don't know, I guess, if it means it's teething time or if they're just
Right.
drooling, right? That's what babies do.
Yeah, they put a lot of things in their mouth. And what my theory is, and I don't know if it's true, she was doing that in the months leading up to it. And my theory is that they're not popping out, like breaking through yet, but they're shifting, like they're moving underneath the surface, and that's what makes them drool a whole bunch. Some doctor can be like, no, you're full of it. That's not actually what's happening.
We'll talk to the doctor later. We'll ask her all the questions.
Yeah, but her little 2 bottom ones came out first. And now that I'm thinking about it, it might have been around 6 months or so when they like really started poking through. And it was because we were dealing with so many sleep challenges that I didn't really notice. And then just like her cries would be different when I had to go in for like the 7th time in the middle of the night. And like I went
Was
to go
she
like
pain?
I think so. I think that was part of it. Granted, again, whole different sleep episode. There were other issues happening, but that on one particular night, that was part of it when she just sounded different. And I went to put a passy in and I could like feel it. I was like, oh, expletive. Like these are actually popping out. Like that must be so painful. They were sharp too. So yeah, teething is a whole thing, but Kevin, when it does happen and they're all popping through, like sleep might be an issue. It's usually short-lived. There's lots of stuff that you can give them. Like my husband and I try not to do too many like over the counter things. It's only when it's like really, really bad. We use a lot of homeopathic stuff that you can literally just get on Amazon that's like calming. I think they work. Again, it could be a bunch of hooey, but as all tired parents know, if it works, it works. So you continue to do it.
Yeah, that soothing numb gel. I forget what it's called, but yeah, that worked for us as well. And we had to tell Liam's face would get really red. The crazy rosy cheeks would happen when he was teething.
Interesting.
So we would know just by looking at his face. We're like, oh, a tooth is coming.
Yeah.
His cheeks are like red tomatoes.
Yeah, we have a bunch of myths. I'll ask we're going to have a pediatrician on after you. So we're going to ask her a whole bunch of myths too that we've heard about soothing and stuff like that. So you can obviously watch that later. But so yeah, we talked about lots of drooling, like Lila right now, nonstop drooling. Here we can take a look here. I think I got some.
There we go.
There's Miss Lila, and then Jenna obviously are going on a flight. But yeah, lots of drooling, lots of stuff in the mouth. She hasn't been in pain, which is great. And so that's something I'm curious about. Like, yeah, when I thought it was supposed to hurt, and I didn't know what teething was. I was like, wait, is teething when the teeth is already there or the beforehand? I'm a dumb. I'm a dad, right? So we don't know anything. So I'm just over here like, whatever, and throw the baby up in the air, and that's kind of.
And then it makes her laugh, and then everything's better.
Yeah, exactly. So, and I understand also that this is probably not the best for moms who are breastfeeding. My understanding is that probably they're just teething on nipples and stuff. So that's I know we can say that on here. So it's
we can. We sure can. I think by the time her teeth came in, I had come back to work, so I wasn't like nursing as much anymore. I think maybe she must have gotten her first teeth around like 7 months, because we had just like moved completely to bottles, but just like pumping for her all the time by 7 months.
Once there's a tooth, are we just done breastfeeding? Is that
really depends on the
mom. And it depends on the baby too. But I will say, even when she didn't have teeth, when she would like randomly just chomp down, she don't need teeth. It hurts, like no matter what what way you spin it. It hurt no matter which way. So I haven't experienced the teeth part of that. But when they decide that they want to chomp, they chomp, and that's the way it goes. But I'm not sure where we were going with that. But
it's just we're just riffing here,
We have a question about when her teeth started coming out.
Yeah,
was it top, bottom? Typically the front.
Yeah. So she had her first two bottom teeth come in first, and so she was just kind of like a little. Like that. And then I want to say like 10 months, I swear all four of her top teeth like came in at once, and like the front two are kind of like at an angle, so she looks like, I don't know, a little shark. But I look at and I'm like, is that normal? I look at other kids and their teeth are like all over the place too. Now she's got just one popping up on the lower part of the other side of the tooth, so she's got 7. I'm waiting for the 8th one to come in at any moment, but
I look forward to
it hasn't gotten like the first ones were pretty bad coming through. Excuse me. But she hasn't been, that hasn't really disrupted sleep. Like I assumed all those like massive ones coming down from the top would have been really bad. It bothered her a little bit, but I think it's mostly like during the day if Lila just starts to get like pretty grumpy, then, and there's like literally no other reason. One, developmental milestone. Babies can just be grumpy because they want to be grumpy.
Yeah.
Just like people.
Lila's definitely my kid, so she's probably going to be grumpy.
She's going to be a
The drooling was definitely from Jenna, though. Jenna drools nonstop.
Yeah, we all know that. But yeah, if there's nothing, I saw a meme that was like marriage/parenthood is literally one spouse telling the other, I think she's teething, and you go back and forth until one of you is right. Like it's true. It's just like, oh yeah, I think she's teething. Yeah, I think she's teething. Yeah. So that's pretty much what it is. But I saw a study or someone told me that basically it is painful for them, and so it's not for nothing. And that if we were to go through the similar experience as an adult, like we couldn't handle it. Like the pain would be so bad that we couldn't handle it. And I thought that was really interesting. So it's just like remembering, hey, your child is like literally growing parts of their body.
True.
I mean, you should always be nice to your babies, but just like, give them extra snuggles.
Okay.
Snuggles fix everything.
100%.
Annie, thank you so much for your time and giving us all the info. I know it kind of flew by. So
it did.
Yeah.
We're done already?
Hey, we're done already.
I have so much to say.
Wild. I know. I have so many more questions.
We'll have you next time. Exactly. But we're going to have a pediatrician on. We're going to ask her a whole bunch of questions. So that way we'll all still keep learning, right? We have so much more to learn. So we'll be right back, guys. Thank you so much.
Welcome back for the second time with the Tired Parents Club because we were very tired today and had to re-record a couple of couple of minutes of this interview. Today we have with us Dr. Amra Zuzo. She is a pediatrician with Novant Health. Hi, thank you so much for joining us today. We're super excited to talk to you all about teeth. So parents, yes, this is a big one. I know a lot of new parents always have questions about this. When can we expect those first teeth to appear that first year?
Thank you for having me. The first tooth, the earliest that I've seen is 4.5 months, but generally we see them between 6 to 12 months. Average time is around 8 months, and there's tons of drooling. However, drooling can start as early as 3 months. Children tend to drool, put their hands in their mouth for a long time, sometimes several months before the first tooth comes in. So it can be a little bit tricky.
Wow, that's what, 4.5 months you said? That's super early.
Yeah.
Kevin, have you seen a tooth yet?
Yeah, because she's right. We're just at 5 months now. So, no teeth yet. But yes, plenty of drooling. We are constantly going through clothes. Here's Lila right now. There they are teething. But I didn't know that that's what it meant. I thought, they're just babies. Eventually they just, leak from their mouths a lot. And she's got plenty of drool. So I didn't know. I guess, is that just really common? Is that one of the first signs? Is drooling?
Yeah, drooling is very common. They tend to, part of the development is to put your hands in your mouth, bring your hands to the midline, as we say, and that's sort of separate from teething. Drooling starts around 3 months. They start to drool as things start happening below the gum line level. We don't officially, define as teething unless we start to see the eruption of the tooth, kind of the swelling and the redness and things like that. And so they'll definitely drool for a very long time before the first tooth erupts.
Yeah, it's like nonstop. Everything's wet. We change our outfits all the time. It's just so honestly, we've given up on the change.
Maybe it's coming,
Maybe
You got a tooth coming. Liam's came in super early. His was 5 months was the first tooth. And he was just like an absolute puddle. His t-shirts were always huge puddles. The drool was crazy. Could you give us some insight into when a tooth does erupt? Is there a typical order for how teeth come in, or does it just really depend on the baby?
Typically, yes. The first front lower teeth come in, and then the second pair is the front upper teeth, and then it sort of moves from the front to the back of the mouth. Basically, what we tend to see is more symptoms and discomfort the further back you go in the mouth. So as the molars come in, between 18 to 24 months, kids then really start to struggle with sleep and pain and fussiness. But sometimes it can happen with those front teeth as well.
Yeah, that was my question, I guess. Yeah, do certain teeth hurt more than others? And like, do we know why that is?
I don't think we have a really good answer. I think I'll have to ask my pediatric dentistry colleagues. But that's sort of what we see in practice. The first lower front teeth, they just sort of pop up, after several months of drooling. And usually the kids are fairly happy. Some kids do have some fussiness at night, and we tend to see a little bit of sort of higher amount of discomfort run in families, as well as earlier eruption or delayed eruption. It tends to run in families.
Oh, I guess that is a good question. Like, yeah, is there's something to be concerned about if it takes too long? Yeah, if it's, let's say it's 8-10 months or something like that, and you don't see a tooth, is that something to be concerned about?
No, the latest that I've seen a tooth erupt, the first tooth is 16 months.
Wow.
Yeah, it can take a long time sometimes. And the sort of interesting and kind of a nice thing that happens when it's so delayed is that they tend to all happen at once and erupt at once. And so the fussiness is isolated for a couple of months, which is nice for the families and for the child. But as long as the exam is otherwise normal, the jaw and the mouth is normal, and there's no other concerns like with feeding and stuff like that, we can't force them out. So, so we keep an eye on it.
With the feeding, that's a great question that you made me think of, which was the teeth don't really play a role in like when they can start solid foods, correct? I know they typically recommend around 6 months. What's the best recommendation, I guess, for parents with starting solids and teeth as far as that's concerned?
Starting solids, I mean, for a breastfed infant, it tends to take a little bit longer. So 6 months. Some formula fed babies can be fed at 4 months. If you have no teeth, generally speaking, we start with purees or things that are, very soft and that, there's teething wafers that, families can always get over the counter that are helpful and that just kind of dissolve in the mouth. The more teeth that you have, the more texture you can handle. And so it can be very helpful in the solid introduction, especially what we call baby-led weaning, which is when we have families or parents cut the food to finger, bite size, and then we have the babies kind of feed themselves. And so, baby-led weaning will definitely do that when they have at least a few teeth.
So my wife mentioned to me something about spring onions. Is this a thing? I don't know. She mentioned something about spring onions and it's good for teething. I don't know if this is like an old fashioned, witch voodoo like thing from the past. I have no idea. But she mentioned something about spring onions. Do you know anything about spring onions and eating those? And does that help with teething? I don't know if that's a rumor.
I haven't heard. I mean, I've heard it. When I used to practice in South Alabama, I heard it a little bit, but in literature I haven't come across it. We definitely recommend kind of frozen bananas or berries or things like that if you have introduced solids. And when your child is teething, and especially if they're very uncomfortable, we recommend cold foods like that. But generally it's just massaging the gum line just with your finger. Sometimes a wet washcloth. You can even chill it in the fridge or the freezer for 10-15 minutes. You can even use a frozen bagel. They make small little bagels. You can freeze it and kids can kind of gnaw on it. So those types of things I'm more familiar with.
Yeah, I didn't want to do
creative ideas.
I know. I didn't want to do onions because I also like your breath's gonna smell. I don't know if I'm
baby onion breath.
That sounds terrible to me. I guess, and so yeah, we have amber necklaces are helpful. Apparently, is amber a necklace? Is that also
another thing? I have never heard of this.
This is the wife. I'm just here. Yeah, I'm speaking on her behalf.
Yeah, I mean, I do see families using it. Again, we don't have studies supporting this. It is sort of a choking risk because they're around the neck. Some babies do really well with it. Some pull and tug and, do all kinds of flips and flops during sleep. So we do caution families if they're going to use that.
Mm-hmm. Okay.
That's good to know.
Yeah. Hey, you know what? We're going to take a quick break. Stay right there. We have some more questions for you. We'll be right back. All right, welcome back to Tired Parents Club. We have Dr. Zuzo here. So I just wanted to talk about teeth brushing. So once the tooth is here, it has arrived. When do we start brushing? Every day, every hour, every second? Do we not brush at all because we're scared it's gonna fall apart? What do you recommend?
So once the tooth is long enough to where you can touch it and sort of get in there, with a baby toothbrush, it's appropriate to brush the teeth. Oftentimes families worry about using a toothpaste with fluoride, but the American, Academy of Pediatrics, as well as our pediatric dentistry colleagues, do recommend using toothpaste with fluoride. We recommend using a rice grain amount. So it's a very minuscule amount of toothpaste on that brush.
That's exactly what we do. A little tiny amount.
Yeah. I've heard there's a finger brush too. Is that a thing? I don't know.
That one is actually helpful, especially in the beginning as babies are getting used to it, because they tend to get their, gum lines and teeth massaged. So we recommend using that twice a day. And then if you want to wipe with a wet cloth to remove any residue, that's okay too.
Okay. Yeah. Someone at work here, they do the wet cloth. I don't know. We had a coworker. He's like, I didn't know I had to brush it twice a day. It was like every couple of days, and I was like, sounds gross, but I don't know. Again, I think you're just kind of nervous maybe to touch that tooth.
Yeah, when you're a new parent and you're learning and you don't know if you should be brushing the teeth yet or not. I remember we went through something similar with Liam where he had a couple teeth come through and we weren't brushing them because I was like, well, it's only like 3 teeth. Do I need to brush them? They just came out. I don't know. And then we started to realize this sounds terrible. We started to realize his breath. We're like, his breath is like kind of funky. And I was like, yeah, we need to be brushing his teeth. He only has 3, but we need to be brushing them. So then we got the special baby toothbrush. And yes, of course, we've been brushing his teeth ever since. Yes.
Yeah. That's a hard lesson to learn, I guess.
I mean, you don't know what you don't know, right? When it's your first baby, you don't know.
No clue.
And yeah, pointing out the toothbrushes, that there is special baby toothbrushes, and then as they get older, you kind of graduate to the toddler level. Yeah.
The size and the bristle softness definitely changes as you get bigger.
Yes. And we try to make our toothbrushes fun because you have little characters on them.
Yeah.
And he's super into Toy Story right now.
Nice.
So we try to get toothbrushes with like Woody or Buzz on them, just like try to make it fun.
Yeah.
You know.
Good.
Anything helps.
Yeah.
Yes, right? You gotta try and make anything fun.
Yeah. So what are some of the horror stories, I guess, that you've heard related to teething, or even parents freaking out or something?
I think biggest thing is, parents used to, back in the day, several years ago, before we talked so much about teeth, they would give them bottles with milk, and then, kids would get significant cavities, across the teeth.
Because the milk just sits, right?
Yeah, and even like breastfed infants, if they continue to breastfeed on demand, and you don't brush their teeth, they do eventually develop, cavities too. So I think my scariest stories are from that time when we used to see a lot of dental and mouth infections and how severe they can get. And the nice thing about my patient parents are fantastic, and we talk about teeth at the first appointment that I see a tooth, and they're very much I don't get into issues with fear. They're very much like, okay, we'll do it. We tend to talk more about the toothpaste, whether you use the baby toothpaste, the one without fluoride or not, which we don't recommend. And then we talk about the different forms of toothbrushes and how long. I think parents sometimes worry about having to brush for 2 minutes, but it's, the less teeth that you have, obviously you don't have to use the full 2 minutes. So it's sometimes in the beginning it's just half a minute. So I would say, yeah, but those are my scariest stories, but I don't have a lot. So I've been very lucky in my career.
Yeah, that's not too bad at all. And I've definitely heard that too, where our pediatrician has something very similar, like, oh, make sure when he was little, make sure, if you're giving him a bottle before bed, or that it's not just that milk is sitting on the teeth when they go to bed at night.
That's good to know, because I did not know any of this. So, but then again, Lila doesn't have teeth, so I guess I haven't really thought about
Get ready
too much. Yeah. Do you have any more questions?
Sure. So I know with that discomfort, when, let's say, can interrupt the baby's sleep, right? If it's really super uncomfortable overnight, what is the best thing you recommend to parents, if they're going through that? Where is it very similar, where if they're dealing with, lack of sleep, lots of waking up in the middle of the night because they're just, their baby's very uncomfortable. I've had friends that are like, they just cry and cry and cry, and it's just, it can be really rough going through that teething stage.
Yeah. I mean, we have, we recommend those solid teething rings that don't have liquid in them. You can put them in the fridge. You can have the there's various shapes these days, little hands and things like that for comfort. But before bedtime, or if it's interrupting sleep, depending on the age of the child, if they're 6 months and older, we'll say you can use some ibuprofen. It's anti-inflammatory. It lasts every 6 hours. or it lasts for 6 hours, so it needs to be redosed every 6 hours. And we only redose if the child wakes up and has discomfort. If your child is younger and has a tooth that erupts earlier or is trying to erupt, we do recommend Tylenol. To be given every 4 hours as needed. Obviously, lots of hugs and kisses and comfort care and sort of non-medication route is always preferred. But if it's interrupting sleep, for the child, which is really important for growth and, development overall, then we do intervene with some medications.
Okay, this is all great information. Things I can't wait to use with Lila, and yeah, well, I'll let you know how it goes. But thank you so much for your time. Thank you for joining us, and then for everybody else, Sierra, we had a great time learning about this.
Yeah.
Guys, we will be back on Tired Parents Club next week, and we'll see you then.
Queen City News Plus. Just search Queen City News on your smart TV's app store.